Good morning. My name is Ramanjit Kaur. Today I'm presenting the case of the patient named ABC, and she's a 24 years old white female presented with chief complaint of persistent rash and irritation on her right hand, which has begun 2 weeks ago. Patient ABC, she works as a produce cutter and is regularly exposed to bleach products, which I think contributing to her symptoms. She described the rash as worsening with hot water but improving with cold water. She been using over-the-counter hydrocortisone and Benadryl. She has some mild relief from it, but Benadryl causing her drowsiness. Using the old card format, the irritation began 2 weeks ago. Primarily is on her right hand. She has continues with mild flare-ups. She described rash with the visible irritation, hot water exposure making it worse, cold water is relieving it. She has tried Benadryl and hydrocortisone over-the-counter medication. Her other current medication she just have using for asthma management inhaler. She doesn't report any allergies. Past medical history has asthma, but no other chronic condition. Surgical history, no surgical history the patient had stated. Family history, no significant family history related to skin condition or allergies or any other condition. Social history, patient doesn't smoke, she doesn't drink alcohol or use recreational drugs. When we review her system, she denies any systemic symptoms such as fever, chills, or rashes anywhere as on the body, and she reports no respiratory and GI or any other neurological concern. On a physical exam, we have her vital sign shows as a blood pressure 130/86 with a heart rate 77, respiratory of 18, and temperature 98.4 degree Fahrenheit. Oxygen saturation is 98% on room air, which shows her BMI is 45.7. Of course, she's obese. That shows obesity. Skin exam shows localized irritation, a rash on her right hand with no signs of infection. The other rest of the physical exam is unremarkable. I'm thinking going towards my diagnosis is contact dermatitis because the bleach exposure at work, and also contact dermatitis is an inflammatory response resulting from tract chemical irritants, which fits with her working at the produce cutter at the job, and the symptoms trigger. But we can also have other 3 differential diagnoses we can consider. The first one I'm thinking is allergic contact dermatitis, although I'm thinking it's less likely due to lack of systemic allergic symptom. It is possible if the bleach exposure has led to an allergic reaction over time. The second differential diagnosis, I'm thinking irritant hand dermatitis, is common in workers handling harsh chemicals, especially with the skin protection. The third, I'm thinking atopic dermatitis is eczema. Due to her history of asthma, she may have underlying eczema that is flaring up with irritant exposure. The medication we can prescribe, I'm thinking the research shows triamcinolone acetonide 0.51% cream applied 1 to 3 times daily for 1 week can reduce inflammation. A non-pharmacological recommendation, we are giving patient sample of a survey from the office, which can help, and also avoiding hot water is also critical. Diagnostic test is not no immediate tests are not necessary based on her presentation. We will educate patient using gloves at work, limited exposure of the bleach, using lukewarm water, no cultural consideration at this point. Health promotion, just emphasizing skin protection and regular moisturizer. Referral is not necessary at this time, but we will follow up with the patient in 2 weeks to assess her response to the treatment and consider further management. Thank you.